Record to the cloud. All right.
Recording.
Hey, all right. We're recording. Okay. Well, welcome everybody. Welcome to another episode of the Diabetes Reversal Webinar with Dr. Scott Saunders. It's a beautiful January day here. And
In the neighborhood.
what's that?
In the neighborhood.
In the neighborhood, yes. As you're hopping on here, if you are able to hop in the chat, say hello, tell us where you're from. And today's question is, what is your favorite body wash that you use in the shower? I was just thinking about that as I took a shower this morning. I used Dr. Teal's lavender. It's got Epsom salt in it and lavender. Like, it is really good. So it just it brings me to my happy place. I get good ideas. And how about you? Are you an Irish Spring soap guy, or do you have a special body wash, Scott?
Oh, I just, my daughter made a whole bunch of soap about 5 years ago. And this is like pure coconut oil soap. Has no smells in it or anything. It's just pure soap. And that's what I use.
Ah, very nice. So you said the other day you're very functional in, like, because you stayed at our house and I gave you a couple options for where you could get ready, and I'm like, well, you can stay in our newly remodeled bathroom here, and or the one upstairs that's like the kids one. He's like, doesn't matter to me if it's got water, it works for me. I'm just functional.
Well, I used to live in Venezuela. We had a bucket outside that we had to bring in for our showers. It was very sort of just functional.
Ah, very nice. That reminds me, I forgot to do my cold shower therapy this morning. I've been listening to Wim Hof's book, The Iceman, and just the benefits of cold.
That is actually, we should do one on that, because there are a lot of people that have autonomic nervous system. Nervous system dysfunction, and it really works. I've had people do it. So yeah, we should do a conference or a webinar on that.
Yeah, I'll add that to our list. Maybe next week or the week after we could talk about that. And I'll be a few more days into my experimenting with cold showers. So I did it yesterday, and it was good. I felt better all day long. So, and I like that's day one. So I'm sure after doing it for a couple of weeks, it would be even better. So.
Why don't you just jump in your swimming pool?
I would if the cover was not like frozen shut. So. All right, Grace uses soap. Kiss My Face lavender. All right, so another lavender. I'm assuming that's the type of soap. I don't know, maybe that's an essential oil, but. And then Skip only showers once a week to maintain body flora. Hey, that's interesting. So.
Do you know what the other thing, Skip? The other thing that does is allows you to absorb your vitamin D. One of the problems that we have, why everybody's deficient in vitamin D, is because they bathe every day and wash all the oils off their skin, so they can't make vitamin D from their own skin. So that's a good thing, Skip.
Yeah. Choose where you want to. I'm going to see if I can post on, maybe not. I think I'll skip the go live on Facebook feature today. We'll just be live and record here and post it later on YouTube. So, all right. So I'm assuming everyone else maybe didn't hear my question, but if you could hop on the chat, we'd love to hear from you. Tell us where you're from, excuse me, and or what your favorite body wash, shampoo, soap is that you use when you take your showers or baths. So, all right. Good stuff. Good stuff. Welcome, everybody. So today our topic, excuse me, frog in my throat. Today our topic is nerve pain, neuropathy, and we're going to talk specifically about Dr. Scott's research on alpha lipoic acid and benfotiamine. And so that is going to be a deep dive topic today. So that's another thing too in the chat. Towards the end of this call, in about a half an hour or so, maybe sooner, we're going to be opening up for questions, your questions, but feel free at any time to ask questions in the chat or in the Q&A section at the bottom of your Zoom window if you have that. and I will be moderating here and trying to grab those questions as we go. And so, all right. So Scott, why don't you tell us, one more housekeeping thing here. So anything that we talk about, any products that we mention, you can find on bartonwebinar.com. So I'm going to put that link in here. That's kind of our home base for these webinars. And so if you're watching on YouTube later or whatever, you can go to bartonwebinar.com and find links to our different products and different things that we talk about. So, okay, without further ado, Dr. Saunders, why don't you tell us about the research you've been up to lately?
Okay, so the reason I was doing this research is because about 4 weeks ago, my dad got out of the hospital. He'd had a GI bleed, intestinal bleeding, and got really severely anemic, was in the hospital, got a blood transfusion, and they finally stopped the bleeding and everything, and he got out and was still a little weak. And so I went to his house and I was looking over his lab tests, and I noticed a few things. I said, oh, your kidneys are not functioning properly. You know, you have some kidney failure. And your blood sugar is a little high, and then I started asking him questions about how he's doing, and he said, "Oh, I'm having trouble walking." He went to the LA County Fair with a bunch of people. He couldn't keep up with everybody. He was left behind. When he goes to the store, he's getting a cart now, the ride-on cart instead of the push cart, because his feet hurt so badly, and as he walks, his feet get worse, especially the bottom of his feet burning. And then at night, he has trouble sleeping because burning and tingling in his feet. And I'm like, Dad, that's neuropathy. And so he's got heart problems. He can't walk. He gets winded really fast. Heart problems, brain problem. His wife said that he it scares her when he's driving, and he doesn't remember things like he used to. So he's got memory issues. So neuropathy and kidneys and heart, and that's everything. All of the complications of diabetes he already has, and he barely has a little bump in blood sugar. His blood sugar was like 110-ish, something like that. And so. And this is actually not uncommon. Before people even get diabetes, very often they already have complications of diabetes, what we would call complications of diabetes: kidney failure, neuropathy. They already have numbness and tingling in their feet, that kind of thing. So, so I started my dad on immediately the diabetes solution kit. Put him on the diet, but made sure his wife is keeping track of him, because he's not thinking clearly. He's not going to be able to do it himself. And then Nervala, which is alpha lipoic acid and benfotiamine. So I've been doing some research on that. Is there anything else that I could do to help my dad? And what I found was really interesting. So alpha lipoic acid is actually useful for a lot of different things. It's almost to the point of as we age, we should consider taking alpha lipoic acid, even if we don't have diabetes or pre-diabetes specifically. But everybody who has diabetes should definitely be taking it, because it's been shown to reverse retinopathy, or the eye problems, and kidney problems, and nervous system problems. In fact, in Germany, the treatment, the prescription drug treatment, is alpha lipoic acid. That's the way everybody gets treated, and they give it IV, intravenous.
Oh, wow.
Even though it's pretty well absorbed orally. So in looking at this, I think the alpha lipoic acid, what they give in Germany is 600 milligrams twice a day. And that's like, oh, cool. That's when we formulated Nervala. That's what we put in it, 600 milligrams twice a day.
Mm.
And so I was telling people before, I was saying, well, you know, once a day is okay. 600 milligrams is okay. But as I did more research, I think, you know, for the first 90 days, twice a day is a better idea. Because when they're giving 600 milligrams in Germany, they're giving it IV, intravenous. So, so you're getting more of it than you would from when taking it orally. And then there were some other issues. If you're doing research on alpha lipoic acid, you'll see this R-lipoic. So the natural form of ALA is R-lipoic. That's what our bodies make it. We make it. Plants make it. Animals make it. So we have R-lipoic acid in our bodies already. But as we age, we make less, and that seems to be part of the issue. Is that we're making less, so we're more likely to get some of the problems associated with like high blood sugar, so some people will market and they'll tell you, oh, the R-lipoic is the only way to go because that's the natural form and that's what the body makes and that's what the plants make. And they don't have there's R and an L, and the body makes R, but when it's made in a laboratory, you get R and L. Well, it's just interesting that all of the research that's been done has been done on the RL form, and it seems that when you take it orally, the body prefers absorbing the R, and the L form may prevent it from getting broken down quickly because the body disposes of lipoic acid pretty quickly, uses it up fast, where the L form may prevent that from being used up really quickly. So, so what they're advertising that the R is the only way to go, that may not be the case. Actually, the research on the RL for an oral form at least was as good, at least as good, and definitely showed improvement over those who took placebos. So it works, and if the United States was as advanced as Germany, we would be giving it IV to every diabetic that showed up in the hospital that had neuropathy, because that's what works. And so now in the United States, doctors tell their patients, there's nothing you can do about it. But there clearly is, but we're just in the wrong place. We're in a backwards country.
Really do you know any statistics for people in Germany and like those treatments and rates of diabetes and how much that helps or anything like that?
No, I don't know numbers.
Yeah.
I did some research on them, but I'm not going to try and quote them. But it was significant to the range of most people have some improvement, even if they don't get all better. And of course, the further along you are, the less likely you are to have improvement. So it's a gradation thing. If you're barely into it and you haven't had diabetes very long, you haven't had neuropathy for very long, then you're going to see more improvement than if you've had it for 20 years.
Hey, if you're watching this live right now, if in the chat, if you could tell us if you've been using Nervala, maybe give us a 1 to 10 rating of it as far as how much it's helped you and how long you've been taking it. Just give a little bit of information. I'd be curious to see how many people watching have actually used our product. So you can go ahead and pop that in there. One question, Scott. So I've heard from a couple different people that when they take Nervala, they feel like it doesn't, I can't remember exactly the symptoms, but it maybe almost adds a little bit more sensation. Like, I don't know if quite pain, but like they just didn't, it wasn't a pleasant feeling, and almost like they felt like things were getting exacerbated. And I think we talked about this once, but it's actually like what it does to your nerves. It's like waking them up. And so there might be an adjustment period of getting them back online. Can you talk about that a little bit?
Yeah, that's actually really important because when the nerves are dying or becoming non-functional at first, it's really irritating because you get burning pain. Usually it's like burning pain and tingling like pins and needles. And I mean, it's one thing if you fall asleep on your arm and you wake up in the morning and you have pins and needles and you're going, and then it goes away in a matter of minutes. That's one thing. But what if your feet were like that all the time, constantly, and just that constant pins and needles? That'd be a horrible experience. Well, people then, over time, they feel better. It goes away. Well, that's because they're totally numb now. And now they don't have feeling. And that's where it's really dangerous, because if they get any kind of infection or anything, they won't know they have an issue. They won't know that they get like osteomyelitis. So then that's when you see amputations in people that have diabetes, because they can't feel it. And so it gets bad enough, like an infection will get bad enough that there's nothing they can do about it, and they have to cut the limb off. So that numbness is actually worse than the tingling and pain and burning. So if it's numb and you start taking alpha-lipoic acid, guess what's going to happen? You're going to start getting the tingling and burning and all that back again. And you're going to be like, oh crap, now it's getting worse. No, that means it's getting better. That means you have more feeling, which is a good sign. And that's improvement.
Yeah. Okay, good. That makes sense. Yeah. All right. So we had a question from somebody that emailed us beforehand that is related to Nervala. Let me just quick show everybody. This is what our formula, the bottle looks like. It's called Nervala. Helps maintain nerve health, advanced peripheral nervous system support formula. And yes, this does have 600 milligrams of alpha-lipoic acid, and I believe it's a combination of the R and the L version, so the same as what was used in the studies. Heard a lot of good success stories. So one person asked if there's any like contraindications or I don't know what the word is I'm looking for. We'll take omega-3 fish oil 3 hours ahead of time before Nervala be okay? Is there any interactions?
Good question. That's an excellent question. Okay, so alpha-lipoic acid needs to be taken with food, and fish oil is a great thing to take with alpha-lipoic acid. Actually, there were some studies done on ALA with fish oil, and the two of them together actually worked better than the ALA alone. And part of that is absorption, because when you eat, the mechanisms for absorbing fat soluble things are increased. So like your bile acids that make your fat soluble so that they can be absorbed. So that ALA was like 30% better absorbed when it's taken with food. So yeah.
Yep, that's important. Yeah. We do have that to take it with breakfast and with dinner for the first 60 days. Anyway, we recommend, or you recommend, taking 2 per day, 1 with breakfast, 1 with dinner. And yeah. So having with fat as well. So hopefully you're eating fat at each meal as well. So specifically good fats. What are list off a few good healthy fats that have high omega-3s or healthy?
Well, you can't. It's hard to avoid some fat, but if you're on the diabetes solution kit or diabetes reversal program, you're going to be eating fats, and those are coconut oil, the olive oil. People cook with oils. I don't recommend corn oil or canola oil. They're really high in omega-6, which increases inflammation. But fish oil, grapeseed oil is actually really good to cook with. And even peanut oil. You could, if you're cooking at relatively high temperatures, peanut oil is better. But coconut oil is great, actually. But any of those are fine. Those are all fats or oils. So any kind of oil is fat.
Yeah. I like to use avocado oil and olive oil. I'll mix those together sometimes if I'm cooking up some garlic or onions or whatever.
It's really interesting. You have to be careful with olive oil. I was looking at some research that was done on imported Italian olive oils. And in Italy, what they did in order for it didn't to have the strong olive flavor in the olive oil, they mixed it with canola oil. And some of them really only had 20% olive oil and were 80% canola oil. And so the one really interesting was the Kirkland brand, the Costco brand, was one of the few that was 100% pure olive oil.
Oh, well, that's good. Yeah. We've promoted and recommended in the past olive oil from the Fresh Pressed Olive Oil Club, and it's become friends with the olive oil hunter, TJ, and he actually goes around to different countries depending on the time of year to find the best harvest of olives, and it's really good, fresh supply of 100%, extra virgin olive oil. So good stuff there. If you ever see that come through in your email from us, that is legit stuff. I can vouch for that. All right. Next question was regarding metformin. So anything as far as timing for metformin and Nervala together?
That shouldn't matter. It shouldn't make a difference. They're actually absorbed differently. The metformin goes through the liver, and the alpha lipoic acid is absorbed with the fat. So it shouldn't make a difference when you take both of those. Usually metformin's taken twice a day. There's a long-acting version that is once a day. So it just depends on what form you have, but that shouldn't make a difference as far as your alpha lipoic acid.
Okay. All right. Good stuff. All right. So any more to say on alpha lipoic acid from your research?
I'll think of something.
All right. How about benfotiamine? What is that? Okay. How does it work? Yeah. What do you know?
Benfotiamine, this is actually, I found out a lot of new things that I didn't know about thiamine. So thiamine is vitamin B1. And it's really important. It's water soluble and it's easily excreted from the body, and it has to be reabsorbed from the kidneys. So people who drink a lot of alcohol, for example, they urinate a lot more and they lose thiamine because they're running so much water through their kidneys that they're actually depleting their stores of vitamin B1. And then people who drink a lot of water, and I have a lot of people who do that. They're carrying these huge water bottles around, sipping water all day and just drinking gallons of water a day. And I think people are told that they should be drinking their weight in water in ounces or something like that, some crazy amount of water. And they don't realize that they're depleting their supply of thiamine in doing that, vitamin B1. So one of the most common ways of getting thiamine deficiency is alcoholics, because they're drinking so much and it's a diuretic. But people who are taking diuretic pills for blood pressure medication, those who are taking diuretics, they get thiamine deficiencies as well. And then diabetics, because they're urinating all the time, because their blood sugar is high, they get thiamine deficiency. So these are actually fairly common deficiencies in certain populations of people. What thiamine does is it helps the energy systems and it helps the blood vessels. So when you don't have enough thiamine, your blood vessels start breaking down. The lining of the blood vessels doesn't work anymore. And so you don't get good blood flow. So the reason people with thiamine deficiency get neuropathy is simply because the nerves aren't getting enough blood. They're not getting enough oxygen. They're not getting enough sugar and nutrients, and the blood isn't there to take away all of the waste products. So it's a circulation problem, which makes perfect sense because we were talking about like amputations. There's two issues with amputations. One is you can't feel your legs or feet or whatever, so that you don't know you have an infection. But the other part, the second part, is you have poor circulation, so you get infections more easily, and they don't heal very quickly, and they get into the bones. And so the circulation problem is the thiamine deficiency. So several studies have shown that benfotiamine helps the circulation in especially people with diabetes, but people with other kinds of issues as well, and has helped Alzheimer's disease, which is a circulation problem in the brain, has helped heart disease, and helps peripheral neuropathy of all kinds, not just from diabetes, people that have poor circulation in their legs, for example. So adding thiamine is really important, and the studies with thiamine, with the water-soluble thiamine, are about 300 milligrams a day. Benfotiamine now is a form of thiamine that is fat-soluble, and the advantage of this is when it's fat-soluble, it can be absorbed with the fat. It goes all over the body. It doesn't get first pass in the liver, and it's able to get through membranes and be in membranes and help the blood vessels to work better. So you actually get improvement in blood flow, and the blood vessels work better when you increase thiamine. And it's really interesting. In doing my research now, the dose that we have, 150 milligrams a day, is about the right dose from what the studies have shown. And I look back on the Nervala thing, and yeah, we put 75 milligrams twice a day, so it's 150 milligrams a day, which is just perfect.
Good.
So yeah. It's good stuff. And you know what? It's like, as I'm researching this, I'm thinking, you know what? I'm going to start taking some Nervala. I'm going to do my once a week dosing of Nervala so that I can maintain a good level of, because I drink a lot of water too, maintain a good level of thiamine and keep that alpha lipoic acid up.
Yeah, good stuff. So talk about, because we've been talking about this a little bit more personally on our own, but like, talk about like mega dosing in a sense, like once a week. Can you take like, how many pills of these would you take if you just did it once a week?
I was thinking about that. After about 60 days of taking it every day, 4 pills once a week would give you a high dose right off, and then and you could do that twice a week too. I don't know, if you have a problem. Like if you have neuropathy, I think twice a day is still the best way.
Yeah.
But once you don't have neuropathy and your diabetic neuropathy is reversed and you have good feeling in your feet, I think 4 pills once a week because in that dose you're getting 1,200 milligrams, which is supplying the cells with what you need. And then you have a period of time where you don't have any. So that gives a chance for it to decline down. And then you take 12 pills and then your body absorbs it and it goes up. So you have this a lot and then none. And that always seems to be in biological systems the best way to go, is to have a lot and then none. So
I think you went mute. You're muted, Dr. Scott.
Sorry.
There we go.
Hear me?
Yep. Good.
Okay. So I would think 4 pills once a week would be perfect.
So if somebody just got their first bottle of Nervala, like tell me what would happen if they took like 12 of them all at once? Would it just be like you wouldn't utilize all of it and it'd be expensive urine like you said, or would it, do you know like how that works?
Yeah, it would come out in the urine. There's nothing, it's not toxic. There was a case of somebody who took a bottle of alpha lipoic acid who had some problems and benfotiamine as well. But it was a matter of 2 days before all the toxicity wore off, so it wasn't a long-term problem.
Okay, and that was just a one-time deal, so most people it wouldn't be an issue. But best to just stick to the plan, 2 a day for the first 60 days, and then four or so per week or 2.
There were studies with higher doses. There were some studies were up to 1,800 milligrams a day, and 1,800 would be three pills a day, long term. But it wasn't any more effective at 3 pills a day.
All right. Well, that's good to know. Yeah. Okay. So bartonwebinar.com. If you want to order Nervala, just go to bartonwebinar.com and then scroll down at the bottom of the page. You'll see a link to Nervala there. And let me just click it and see what it says here. It goes to our Garden of Original Greens store, which is our the supplement side of our business, and it's $49 for 1 bottle, or you can get 3 bottles for $39 each. You get free shipping, and if you get 6 bottles, you can get them for $33 per bottle, and that'll last you for quite a while. So, all right, we had another question come in from Matt, and this is a good question. It's he said, can you have neuropathy of the tongue? If so, how is it treated?
Okay, yes, you can have neuropathy of the tongue, but it's not generally due to diabetes. It's not the same as what we're talking about with diabetic neuropathy. So it's not because of a lack of vitamin B1. Neuropathy of the tongue usually happens from, well, B vitamin deficiencies, but usually like B12, B6, B9, B12. One of those B vitamins. They cause numbness, tingling of the tongue. If you have it only on one side of your tongue, like people say, oh, this side of my tongue, then that's usually something different. That's a nerve problem in what's called the cranial nerves. And that's not neuropathy. That's, well, it can be tumors, it can be strokes. There's other reasons for that too, because that's a specific lesion. Whereas neuropathy of the tongue is usually the whole tongue. The tongue can swell up, and so taking a B complex with all the B vitamins, and then I usually give people shots of vitamin B12 if they have neuropathy of their tongue. The tongue gets red and a lot of fissures in it and swells up, and it feels numb. I give shots of B12 also. Yeah,
that's helped. Someone on our team had an issue, and that helped a lot. So it was a combination of those B12 shots and the Nervala. So, yeah. All right, let's see. We got a couple new messages. So yeah, feel free to ask questions now. Now's your time for getting your questions answered. From Tim, is it a reasonable conclusion to believe high blood sugar readings in the morning after sleeping, say 135, and then have afternoon readings after lunch of 105? Are they more related to the liver and not the pancreas?
Oh, that's a good question. Yes, that's true. So what happens overnight is when people who have insulin resistance, they have relatively high insulin. And then overnight when they're not eating, there's nothing in their stomach and their insulin's still high, then their blood sugar drops too low at night. And so they release what's called glucagon, and the liver starts making a whole bunch of sugar. So in the morning, their blood sugar is actually higher than it is during the day. Because the liver is putting out this extra sugar because it dropped too low usually. But for whatever reason you're making glucagon, usually it's because blood sugar's low from not eating, from fasting.
Tim, do you want to share any more? Like, what does your evening food consumption usually look like? Time that you eat and things like that. That'd be interesting, because I have similar, like my blood sugar, I don't have diabetes, but my blood sugar is typically higher like in the morning a little bit, but then afternoon it back normal. So it's interesting. Let's see. I don't see any other questions right now. So, oh, here we go. So Skip, is stimulating the vagus nerve a good idea?
Oh, that's interesting. So the vagus nerve, if you don't know what the vagus nerve is, it's the autonomic nervous system. We call the sympathetic nervous system, and that's the part that gets you awake and alert and active. It's like the adrenaline that gets you going. It makes your heart beat faster. It stimulates your intestines to work. And so if you stimulate the vagus nerve, then you tend to get more activity in like the pancreas and the liver and the stomach and intestines, and other parts of the body as well. The vagus nerve also controls the bone marrow and your immune function. And so stimulating the vagus nerve has a good side and a bad side. And the good side is you stimulate function of things to work, perhaps work better. But on the other hand, you also get overstimulation of the vagus nerve, which, like in the adrenal glands, produces extra adrenaline, which causes, for some people, anxiety, palpitations of their heart, chest pain, shortness of breath, and the symptoms of overstimulation. So this constant fight between being sedated and stimulated is the yin and the yang of the autonomic nervous system. So the vagus nerve is the yin, the stimulating, and then the other is the parasympathetic nervous system, which is the relaxing. It's like when you're laying on the beach and you're relaxed and you're warm, and all of that is the parasympathetic nervous system. So what you really want is balance. And so when we were talking about the Wim Hof method of jumping into cold water or taking cold showers or ice baths, that is to give the contrast to the body so that you can reach a set point. You have to be warm and then cold. You have to be eat and then fast. You have to have the contrast in the body to keep your autonomic nervous system have a normal set point. It keeps the pressure normal, your temperature normal, and all of those things. Only if you have contrast. And you know what? In modern society, we're all pansies. You know, we have to go from our air-conditioned car to our air-conditioned house, to our heated house, to our heated car, so that our temperature is always 70 degrees no matter what. And we don't have contrast outside of us to help our autonomic nervous system reach a set point.
Mm-hmm. Yeah, that's interesting. It's kind of talking about, like, Wim Hof talks about breathing, and when you're doing a cold shower or cold therapy, like, the goal is to get your breathing under control, and it's really stress management, and it kind of prepares you for, I think, other life situations that come your way. So when something stressful happens, you're more likely, your body's better able to adapt and handle that stress. So that's part of the benefit of that cold shower therapy as well. Makes you more resilient. Yeah.
Yes, it makes you more resilient. That's exactly it. Yes. Yeah. Perfect.
Yeah. All right. So Tim, follow up here. Well, while we're talking about the vagus nerve, so does Nervala help with that at all? Do you know specifically, or is it just?
I don't know. The alpha lipoic acid, if there's, I don't think that the vagus nerve has the damage that the other peripheral nerves do, or poor circulation. It's not usually a problem in the central area, in the body area. It's really more of a problem in the peripheral area, like the hands and the feet, because they're much further away, and the blood supply is diminishing as it goes downstream, so to speak.
Yeah.
So I don't know. I don't think so.
Yeah. Okay. Let me get back to Tim here. So Tim was talking about having higher blood sugar, 135 in the mornings and 105 later in the afternoon. We talked about the liver. So he says he eats from 11 a.m. to 7 p.m. based on Dr. Saunders' video series, which is great. Intermittent fasting. So wondering about addressing the liver. And he says he does have alcohol 4 days a week typically. Tim, do you want to clarify, do you have that before 7 p.m.? I would assume so. But yeah, can you maybe talk about maybe how alcohol affects that? Because I know alcohol definitely affects the liver.
Well, not just the liver. Yeah, alcohol affects the liver. It affects the sugar big time as well. Mm-hmm. So getting off alcohol sometimes is all somebody needs to get their insulin under control, because alcohol causes a release of insulin pretty quickly, and then every little bit of alcohol we drink damages the liver. The nice thing about the liver is that it regenerates, and so as long as you have a strong liver, people can tolerate a whole lot of alcohol. But otherwise, I just recommend that people who have problems with blood sugar not drink alcohol, just because, for the same reason you're not going to drink orange juice, really, more than anything.
Yeah. So any tips for, if you're used to having alcohol quite a bit, I suppose it's personal, each individual for each person, but like, do you recommend cold turkey or weaning off of it, just minimizing it to
cold turkey, turkey. Yeah. And you know what, if somebody has an alcoholic drink occasionally, that's not a big deal, but the regular, I don't know, 4 days a week, I don't know if that's a big deal either. But the people that I see have problems are the ones, oh yeah, I have my glass of wine every night. Mm-hmm. Those are the ones. So every night before you go to bed, you have a glass of wine. Well, you're raising your insulin right before you go to bed. That's not a wise thing to do. Mm-hmm. And I wonder, I don't have anybody that's ever done this. I wonder if people had a glass of wine with breakfast in the morning, and and that's their only drink, if that would be a big issue. Probably not, but I don't know.
Well, the other thing with alcohol that I've learned, because I've become friends with Todd White, the owner of Dry Farm Wines, and they sell like 100% natural organic wines that have no preservatives or chemicals added to it. And they talk about like the amount of additives and preservatives added to wines are just insane. And like I've tasted the difference. Like it's night and day when you have a regular glass of wine, which is 98% of the wines that are out there, versus what they sell, which is natural. Like it's, there's no, like, you don't get hangovers. It's clean. It's a lower alcohol content a little bit as well. But so that's, that is something that if you have to have your wine, at least choose, that type from Dry Farm Wines. They're a pretty popular company now. You can find them online, but probably best to avoid alcohol, especially if you're dealing with diabetes and blood sugar issues. So let's see. I had something else I was going to say, but I forgot now. Back to bartonwebinar.com. I was reminded to let you guys all know, you may have seen this in our emails, but we're doing a liquidation sale of our Healthy Gut Support. And the reason for that is probiotics typically have a short shelf life. They are stamped with a March of 2020 expiration date. So we've got a little bit left on the shelves, and we are blowing them out. So $14.95 a bottle. Typically, normally they're $47. So this is a huge savings. And, this is Dr. Saunders, talks about different patients that he has that has been using this and having great results. And so, this is a good time if you want to get some probiotics and digestive enzymes, healthy gut support. Just go to bartonwebinar.com, click on the link, and it'll take you to our inventory liquidation sale. Still comes with our full 365-day money-back guarantee, and we will be getting a new shipment in. It's going to be probably a couple months yet, though. So this is going to be, yeah, we won't have this for much longer. So get that while you can. Let's see here. So Tim says, great, love his response. Thank you. You guys are great. Thanks, Tim. Appreciate the feedback. Glad we can help you guys get questions answered. And Skip wanted to clarify that he's having some issues with his voice. His voice has been hoarse, and I think that was what prompted his questions about the vagus nerve. So, yeah, I don't know. You have any tips on why his voice might be hoarse that we could? Well, that could be.
Okay.
Yeah.
The voice is there's what's called a laryngeal nerve, a recurrent laryngeal nerve. That can be related to hoarseness. Sometimes the thyroid is related to hoarseness. Sometimes it's allergies. People who have chronic allergies often get hoarseness. And some people with acid reflux, if the acid is at night getting up into your esophagus, and then it gets into your throat and in the larynx area, then sometimes people with chronic hoarseness, it's just because of acid reflux. So those are the things that you have to look out for to see if you have one of those type of things that it's causing the hoarseness. Because once you deal with the cause, it's easy. If you don't know what's causing it, then you're shooting in the dark. You don't know what you're doing.
Mm-hmm. Hey, Skip, let us know if you're following the 610 reset plan. That's another thing I can mention on bartonwebinar.com. There's a link to our Facebook page called the 610 Reset. If you're not already a member, if you haven't joined that, that's our group where we kind of help each other stick to the stop eating by 6 o'clock at night and be in bed by 10 o'clock at night, and the health benefits of having an empty stomach when you go to bed, and optimizing your HGH, human growth hormone production, and totally resetting your body as you sleep, and you'll sleep better and all that. So join our Facebook group. It's called 610 Reset, and we'll approve your request to join if you haven't already. The link is on bartonwebinar.com as well, or you can just search on Facebook. So if you're watching this recording on YouTube, be sure to subscribe to our channel so you can get notified of new webinars that we post or videos. We do these every week on Tuesdays at 10 o'clock Central Time in the morning. And also, real quick before we go, thinking about doing a cooking show, a low-carb cooking show, where we would have a friend of ours is a nutritionist and a health coach that makes amazing food, all low-carb. She coaches people, and so we're talking about possibly doing a cooking show, like probably 5 or 6 o'clock at night. She would go live. She would tell you what she's making, give you some ideas, but let us know in the comments or in the chat if that's something that you would be interested in, and any ideas you might have on that as we wrap up here. But I just want to get a little feedback, see if that sounds like something you'd be would be interested in attending. So all right, well, I think I've covered most everything on our list for today, and appreciate everybody joining us, and just want to close out with a quick disclaimer. So everything that we talked about here is for informational purposes and educational purposes, not intended to be a substitute for professional or personal medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions. Don't disregard professional medical advice or delay in seeking it because of something you've read or seen here. So this is all just sound advice. Don't stop taking medications without your doctor's approval. But, you know, I will say, like, bring a copy of that diabetes solution kit to your next doctor visit. Show them your eating plan and help to educate the medical community on what's working, because I think sometimes we think that doctors are just, only want to prescribe medications, and I don't think that's true. I think they want to help people, but they just don't necessarily learn these things in medical school. And so show them what's working for you as you get your blood sugar numbers and A1Cs tested and they're going down and seeing improvements. Tell them what you've been doing, and let's just continue to experience good results in your life, and spread the news with others. So I want to close here. I'm sitting next to this chalkboard. I've got a freshman in high school, and he had a New Year's party, had some friends over, and one of the girls here wrote, "The Lord is on my side. I will not fear." Psalm 118:6. So I hope that's encouraging to you. Just remember that the Lord is on your side, and my heart is for us to be living how God called us to live, what he created us for. Everything that, God created the earth and put everything in it that we need for good health. And so things like, all these natural remedies that we talk about, they really are a way to glorify God by using the things that he's given us. And we typically don't need medications and things like that when God's already given us all that we need. And so things like alpha lipoic acid that we talked about, vitamin B1, benfotiamine, these are the types of things that we learn and study and research and benefit from. And they make us feel better, and it's natural. There's no toxic side effects. It's such a great, refreshing way to live. So I encourage you to find more ways to incorporate natural remedies into your life, and keep on remembering, fill your mind with truth that the Lord is on your side. Do not fear. Fear causes stress, and stress causes high blood sugar. So thanks for joining, everybody. Dr. Saunders, you have any closing comments here before we call it a day?
Oh, I agree. I agree with what you said. The Lord is on your side, and just keep going. Don't give up, because eventually it all works out.
Yes. Amen. Okay. Well, good stuff. Thanks, everyone. Thanks for joining us, and we will see you next time. So, and also we do have an archive of all of these webinars recorded on our YouTube channel. So go check us out. I think it's called Barton Publishing TV on YouTube. And lots of other questions answered. Been doing this for close to 6 months now and have no plans to stop. So we enjoy interacting with you. So thanks for joining us. God bless. Have a great day. See you next time. Scott, do you have a closing joke for us?
No, I don't.
No jokes this time. Okay. All right. Well, we could talk about the crazy dream you had about driving around in a convertible together, and you were driving, but maybe we'll get like a dream translator to try to analyze what that means.
Yeah, because it happened, when you have recurrent dreams, that's like, wow, I had that dream twice.
Yeah. If you have that a third time, then I'm coming out to California and I'm going to rent a convertible, but I don't know if I'm going to let you drive. That's the only thing.
Yeah, I was driving crazy. I don't know.
California drivers. All right. Stop recording. Yes.